Hi guys, it's me again, Dr. Samina Rahman. Sorry, it's been like more than a minute since I've posted a video. Life has continued to go on with, changes in my practice, moving locations, family, summer, kids, the works. So I don't have to explain it to most of you. You know that life can get busy, but I did want to take the time. It's still September when I'm recording this. So it's Sexual Health Awareness Month, and I wanted to talk about an issue that comes up in my office a lot with regards to low libido or low desire, known as hypoactive sexual desire disorder. So let's get at it. So here we have this HSDD diagnosis that I just said, hypoactive sexual desire disorder. Some good screening questions that help us come up with this diagnosis, other than just like me talking to my patient and getting an understanding that this has been going on for about 6 months at least. And transient lack of desire due to certain conditions occurs when it becomes bothersome is the key. So I may ask, are you feeling sexual interest or desire? Are you receptive to your partner's sexual desires and interests? And while, after initiation and during sexual activity, do you lose desire and interest? And if all these, happen, but you're not bothered by it, so be it. But if they happen and, you're concerned, worried, frustrated, grieving, upset about it, or it's messing up your relationship and that's concerning to you, that's when we got to figure out, what's going on and, what we can do to help you. So I'm going to pull out this diagram that I just made and, hopefully you guys can follow along. But basically, I have to give a shout out to Dr. Cheryl Kingsbury and Dr. Erwin Goldstein. I learned so much from them all the time, but I've taken some of these bits and pieces from, discussions and lectures I've attended and been with them. But basically, if we think about the brain being a sexual organ, and the prefrontal cortex, or the PFC of the brain, is one of the aspects that initiates this. And you guys have heard of flight and fight mode. You guys have heard of the parasympathetic and the sympathetic nervous system. This is pretty much the same when it comes to sexual desire and arousal. We have excitation and inhibition, which essentially excitation is sort of reproductive mode, and inhibitions in the brain is really like your survival mode. So we can tend to tune into two modes, either reproductive or survival, if you think of it in a very primitive terms. And that's kind of what we think about in terms of factors that are impacting sexual desire, is what's increasing excitation or decreasing excitation when it comes to low desire, and what's increasing your inhibitions, so putting you more in sort of survival mode versus reproductive mode. And so there are a lot of factors. Remember, I've spoken about this before, that we look at everything sort of in the biopsychosocial aspect when it comes to sexual medicine, and that's how we create treatment plans too. So what we have is, your excitation and inhibition. Excitation, remember, is reproductive mode. Inhibition is survival mode. These are some neurotransmitters and hormones, which are signals that your brain sends all over the place, that can impact all of the above. So you guys have heard of dopamine, norepinephrine. You may not have heard of melanocortin. I'm sure you've heard of oxytocin, especially if you've ever had a baby. These are both neurotransmitters, and we have to throw testosterone in there as well. Neurotransmitters and hormones that impact or would increase your excitation or get you into a reproductive mode. And then, you have factors such as, intimacy, shared values, romance, your past experiences that may also contribute to sort of the excitation mode in your brain that would trigger a good desire or normal desire or high desire. And then alternatively, when we're kind of in flight or fight, in survival and inhibition mode, right? What turns us off, basically? Opioids, we know, serotonin, which we're always trying to increase serotonin with people that have, depressive symptoms. So obviously serotonin is a factor, and endocannabinoids, they sort of increase inhibition. So we look at those things also impacting your sexual desire. In addition, we look at your relationship issues. Are you in a bad relationship? Is there, any kind of psychological, emotional, or physical abuse happening? Any history of that? Do you have any stressors in your life? Are you a midlife woman balancing, kids as well as parents, as well as career? And all of these are culminating to your lack of sleep, which means that you don't have any desire anymore. These are all factors that are affecting it. Did you grow up with negative beliefs around sex, culturally, religiously, or whatever the case may be, which I address a lot in my office, and what your past experiences and behaviors are. Again, biopsychosocial. So there's a biologic factor, there's a psychological factor, and there's those social elements as well that either preclude sexual activity or encourage it. And so these all impact your desire as well. And these are the things that we look at. So typically, if I see a patient in my office, I'm looking at what their medical history is, what medications they're taking, because we know that antidepressants, anti-anxiety meds, or some antihypertensives can impact these different pathways and also cause these issues to happen and desire to go down. There's different times in your life that you might feel, less desire from a hormonal standpoint, especially for individuals with ovaries, for instance. We have sort of, postpartum, where your hormones are really, declining, and you are under a lot of stress, and you have a new baby, and all these things that impact. You have post-menopause, which again, diminished estrogen, diminished testosterone. You're in the midlife. All these issues are impacting your desire as well. Post-hysterectomy or post-oophorectomy, where you've had your ovaries, tubes, and uterus potentially removed, and these impact your sexual desire. So you got to look at an individual as a whole. We got to look at their medical history. We got to look at their medications, and we got to look at their surgeries, as well as cultural factors, social factors, and all of that we know can impact your sexual desire, your sexual arousal, orgasm, all of the above. So these are all important factors that I always discuss with my patients, and I always look at in detail as well. So there we have sort of looking at your history, looking at your surgical history, looking at your cultural history, looking at all those factors, and I've discussed how these are potentially implicated in the lack of desire that you're feeling, or hypoactive sexual desire disorder. And so what do we do next? Well, again, as I've discussed in other videos, I always, and most of us in sexual medicine, will utilize a treatment plan that includes biopsychosocial aspects. So the first FDA-approved medication for hypoactive sexual desire disorder is Ade. It is, flembanserin. It's basically a serotonin receptor agonist-antagonist. So it's supposed to decrease your serotonin levels and increase your dopamine and your norepinephrine levels in the process, which results in an increase in desire. And it's been studied in premenopausal women. Initially, it was studied as an antidepressant, but didn't work as an antidepressant, but did show increase in sexually satisfying events. Again, first FDA-approved medication. It was touted as a Viagra, but it's different in that it's not an on-demand medication. You have to take it every day for at least 8 weeks to see a benefit before discontinuing it. The other things I tell my patients is to take it at night before you go to sleep, because it does cause sleepiness, and it also could cause dizziness as well. And so I always just say, hey, get into bed, have it next to your bedside, take it right before you go to sleep, and then hopefully you sleep more soundly, and we improve your desire at the same time. But again, it has to build up into your system for that. It first came out with this, huge black box warning because, mixed with alcohol, it was causing, low blood pressure, hypotension, or syncope, where you felt like you're going to black out or pass out, which, interestingly enough, can happen with, almost any centrally acting drug or antidepressant. But again, because this is a medicine approved for sexual desire in women figured out that this was a black box warning. But it has to be really large consumption of alcohol. So, you know, I always tell patients, if you're going to go out and get drunk, and just skip your dose that day, because you might actually, you know, pass out or get really low blood pressure dangerously. So this medicine I do prescribe to patients in the right settings, in the right indication. Again, it's 100 milligrams at night a day for patients with HSDD who are premenopausal. And, you know, most of my patients on it that have stuck with it and that it works for, they don't want to be taken off of it either, because it's helping them in so many capacities. Again, so Vyleesi, melanocortin receptor agonist, and it's great for like sort of on-demand use, 45 minutes before desired activity, no more than 1 in 24 hours, and no more than 8 in a month is recommended. We don't use it in, obviously, if you're pregnant, if you are having uncontrolled hypertension or cardiac disease. Yeah, I think those are the big things with Vyleesi, which is a great medication for my patients with this condition in certain circumstances. Additionally, you know, I get asked all the time, can I just take my, you know, husband's or significant other Viagra, which is a phosphodiesterase inhibitor. So in the studies that have been done on women, like Viagra really hasn't been helpful for HSDD purposes, but I will discuss it potentially in my future videos on arousal and orgasm dysfunction, which we have seen some potential benefit in that population, and even compounded in some patients. So stay tuned on that. Okay, and I don't want to forget the Rosie app. The Rosie app is an app that was created by a dear friend of mine, Dr. Lindsay Harper. She's an OBGYN, board certified sexual medicine expert as well, who created this app. Initially, you know, really focused on hypoactive sexual desire disorder and improving desire through, you know, erotica and other things. But the platform has changed a lot, and it's more integrated into different topics. There's educational segments on, you know, religion and sexuality. There's topics about, you know, menopause and sexuality. There's just around, you know, survivors of sexual assault. I mean, so much great information there by a lot of great leaders in this field. So I highly recommend anybody with issues around sexual dysfunction to download that app and get started in some of those treatments that are available. Read some of that erotica. There's coaching. There's a lot of great stuff. So the Rosie app, ROSY, you can download, you know, through Apple or any other the iOS or, you know, Samsung, any of those systems, you can download it through. So there we have it, some good intro information here about hypoactive sexual desire disorder, and some potential treatment options that are out there. Again, we have to look at the biopsychosocial aspects of all that we're dealing with and a treatment plan based on all of the above. But I hope that you guys have gotten some good information about, you know, low desire and when it becomes a dysfunction, and trying to get your groove back when you're trying to like improve your relationships, or even just feel better about yourself. So, you know, if it's just going out, spending time, date night, erotica, you know, role play, whatever, some of these things you'll start with, but sometimes you need a little bit more aggressive therapy, either in the form of cognitive behavioral sex therapy or, you know, medications. And so, you know, don't be afraid to discuss any of that with your healthcare provider. And again, always look for someone who's trained in sexual medicine through ISHWSH, the International Society for the Study of Women's Sexual Health. The providers listed on that website are more than able to help you with your sexual dysfunction journey. Thanks again. Please like and subscribe to my channel, and hopefully I'm getting back in there with you guys to do some more videos that you might find helpful. Please, you know, drop me a note, let me know what you think, add any comments, etc. And hope to see you next time. Thanks.